Hey, it's Dr. Yeager, and if you don't know what these are breast implants, and these are different types of breast implants. We only use FDA-approved breast implants in Yeager Aesthetics, and I want to go over the differences between the types of implants. So the basic difference is the difference between a saline-filled implant and a silicone gel implant. Both of these implants are permanent implants, meaning you don't have to exchange them every 10 years. You can keep them in for your whole life, unless something happens like they should break, or you can get an infection, or you get a scar tissue, or you just don't like them. But to change them, just to change them, you don't have to do anymore. So why saline versus silicone? So saline, the advantages of saline, they cost a little less. They have this little valve that they're filled through, so because they go in your body empty, the opening is a little bit smaller. And if you have small differences between your left and right side, like many women do, you can put a little more or less saline in one side than the other to balance them. The disadvantage is when you're feeling them, they're more two-dimensional. They're more like a balloon. They don't move as naturally as a silicone gel implant does. If you have at least a full B-cup breast and you're going above that, it really doesn't matter because you're not going to feel either one. But if you have less than that, I tend to recommend silicone because it feels and moves more naturally. The other type of implant you might be asking is, what is that implant? This was the gummy bear implant, and the original thought of it was a shaped implant with a firmer gel inside, and we do use this gel in other implants now. But if you look really close at it, this implant, the outer surface is different because it's what's called textured. And it's been found that textured implants are associated with a type of lymphoma, a type of cancer, in super rare occasions. The advice now is not to remove these implants if you have them, but we're not to put these implants in anymore. So if anybody wants to give you a textured implant, say no.